Hi, I'm Jackie Shapland. I'm a nurse prescriber within the Community Learning Disability Health team, and the things that I will do is work alongside other members of the team to work with the person with a learning disability and their family and carers to assess the medication and the risks and the benefits of that medication. We very much worked to the agenda that was identified in the STOMP national programme that came on board a few years ago, and Combined Healthcare signed up to this. STOMP means Stop the Over-Medication of People with Learning Disabilities. And we know that lots of medications that are prescribed for mental health conditions are also given to people with learning disabilities, and that's fine if somebody has a mental health issue that's going to be supported by a psychotropic medication. But we also know that these psychotropic medications are given sometimes when people present with behaviours that can be risky, that have associated risks with them. So we also know that these medications often then stay prescribed for a long period of time without appropriate reviews and without any consideration to whether they are still beneficial, and thinking about the risks that these medications bring too. So very much my part of my role is working alongside to review these medications and make considerations around the risks and the benefits of that medication for that individual. So I will work with the person with a learning disability. I will assess their current presentation, thinking about their quality of life, thinking about medication should be the last option and not the first option when we're looking at treatments. I might make onward referrals to the PBS, the Positive Behavioural Support Nurses, so that we're very clear that somebody has a good quality of life and they're happy with the life and the support they're offered. At that point, we can then think about whether medication can start to be rationalised and looking at slow discontinuation if it's in agreement that that's appropriate and the person wants that too, or we do it in best interests. So the STOMP agenda is very important for all of learning disability services, and it's key for me as a nurse prescriber to work towards the agreed outcomes under the STOMP agenda, and that's to reduce medications that are inappropriately prescribed, but actually make sure that when medication is needed, it's prescribed appropriately, reviewed consistently, and the risks and the benefits of that medication are made aware to everybody, including the person with learning disabilities. And then also thinking about the physical health of that person and how medication can affect the long-term physical health. So linking in with the GPs and making sure that appropriate annual health checks are done and appropriate checks are done on a yearly basis. That would include bloods and heart traces if somebody is felt to need a medication like an antipsychotic medication. So please do get in touch if you want to know any more about the STOMP agenda or about nurse prescribing in the learning disability team. Thanks.